Breast cancer is uncommon in young women, though some studies and resources use different age ranges when referring to this group. We're generally talking about women under 50. The incidence of breast cancer in women under 50 has been slowly rising since 1980. For all women, the incidence of breast cancer in the US increased by 1% a year from 2012 to 2021. But in women under 50, the increase was much larger at 1.4% per year, compared to women 50 and older at 0.7% a year. Black women under 40 have higher rates of breast cancer than white women, even though white women have higher breast cancer rates overall. We're not sure why young Black women have a higher incidence of breast cancer. It may be partially due to differences in known risk factors that vary by race and ethnicity. Genetic factors also put some younger women at a higher risk of breast cancer. For example, women diagnosed younger than age 40 may have a BRCA1 or BRCA2 inherited gene mutation. These inherited gene mutations increase the risk of breast cancer and ovarian cancer. If you're concerned about your risk of breast cancer, talk with your healthcare provider. Be sure to share your family history if you have this information. One thing to note is that breast cancer screening isn't recommended for women under 40 unless they're at higher risk. Some women are at a higher risk based on a variety of factors, like having an inherited gene mutation, including BRCA1 and BRCA2. If you're at higher risk of breast cancer, you may need to start screening earlier and have it done more often than other women. Because breast cancer is uncommon in women under 40, healthcare providers are more likely to consider a lump or other breast change to be a benign breast condition than breast cancer, and advise watching it instead of immediate follow-up. If you're a young woman who's worried about how a breast change was evaluated, it's okay to ask your healthcare provider to order tests to find out more information or to get a second opinion. Young women may sometimes ignore the warning signs of breast cancer because they think they're too young to be at risk. It's important for all women to know how their breasts normally look and feel so they can talk with their healthcare provider about any changes. For more information, you can visit the Breast Self-Awareness Messages page on Komen.org. When breast cancer is diagnosed in young women, it tends to be at a more advanced stage. Breast cancer in young women is more likely to be fast-growing, higher grade, and hormone receptor negative, which makes it more likely to need chemotherapy. While treatments can be effective, the prognosis or outlook tends to be worse for women under 40 than in older women. Young women also face a unique set of issues. They often receive aggressive treatment, which can bring challenges such as fertility problems and sexual concerns. For example, chemotherapy can cause early menopause, leading to uncomfortable physical and emotional changes. Some young women may also deal with changes in their body image and physical well-being that can affect their emotional health and sexuality. Some breast cancer treatments can affect a woman's ability to have children. If you wish to have a child after treatment, you should talk with your healthcare provider and, if possible, a fertility specialist before making treatment decisions. Many of the drug therapies used to treat breast cancer are not safe during pregnancy because they can increase the risk of birth defects and miscarriage. You may be able to freeze and store fertilized or unfertilized eggs. Some drugs can shut down the ovaries during chemotherapy to help preserve fertility. Meeting with a fertility specialist as early as possible, ideally before treatment, offers the widest range of options. Some young women with breast cancer may feel isolated or different from other women their age. At a time in life where many are focused on starting a family or building a career, treatment becomes a top priority, bringing unexpected changes. Support groups and one-on-one peer mentoring programs can help young women cope with their breast cancer diagnosis. A healthcare team member, such as a social worker, can provide information about available support services. You can also reach out to Komen's Patient Care Center. Our navigators offer free, personalized support to patients, caregivers, and family members. They can share trusted breast health and breast cancer information, connect you to services and resources, provide emotional support, and more. Get connected with a Komen navigator at 1-877-GO-KOMEN or 1-877-465-6636, Monday through Thursday from 9 a.m. to 7 p.m. Eastern Time, and Friday from 9 a.m. to 6 p.m. Eastern Time. or by email at helpline@komen.org. To learn more about young women with breast cancer, you can visit the Unique Issues for Young Women with Breast Cancer page on Komen.org. You can also visit the Breast Cancer Statistics page for current statistics about young women and breast cancer.